Next up, we are so excited to have joining us today Dr. Sandie Ha, who's joining us from University of California, Merced. Sandie Ha is an environmental and perinatal epidemiologist whose research interests center on identifying and understanding environmental risk factors for health across the lifespan with a focus on perinatal health. Her work utilizes a range of innovative epidemiologic approaches using data from large population-based data sets, clinical populations, community samples, and intervention studies. Given an increasingly diverse at-risk population and the growing complexity of environmental threats, she's also interested in identifying vulnerable subgroups to help target effective intervention. So excited to have you, Dr. Ha. Thank you so much. Welcome.
Thank you. Thank you so much. Good morning, everyone. First of all, thanks to Nurturally for putting together this really important symposium. And thank you all for being here and for, either in person or remotely. And thank you so much, Rupa, for that wonderful talk. I am a big fan of your work, and you'll see some of that going through in this presentation today. First of all, I have no conflict of interest to disclose related to this talk. And you've heard about this climate change earlier today. And one of the, there's no no doubt about the fact that climate change has many important, profound effects on health. And some of the effects that we saw from climate change include extreme heat, which we heard just a little bit earlier. In this figure that I took from the CDC, it doesn't include adverse pregnancy outcomes. It is an emerging field. We're now including pregnant people as sort of a vulnerable group, but not consistently yet, I think, and we need to work towards that. But one of the environmental effect of climate change is air pollution. And a lot of that is, of course, related to the increased incidence of wildfire, which I'll touch upon in a little bit here. And air pollution has been linked to respiratory and cardiovascular diseases, but the work relating air pollution to adverse pregnancy outcomes are there. Of course, I'll talk about this later, but we're not at the point where I think we recognize enough in terms of the impact of air pollution on pregnancy outcomes. And so, of course, with that, today, the talk that I'll be presenting is going to be on the impact of air pollution on adverse pregnancy outcomes, and more so reproductive health outcomes in general. The WHO refers to climate change as the biggest public health threat of the 21st century. But like I said a little bit earlier, the reproductive health impact of climate change, including air pollution and extreme heat, have not received adequate attention until maybe the past couple of decades. And in fact, the Intergovernmental Panel on Climate Change, for the very first time, mentioned pregnant people as a vulnerable population for climate change effect in 2022. Right? So given all these impact, it's really, we're just starting to recognize the reproductive impact of air pollution and extreme, basically climate change in general. So for this talk, air pollution is defined as the presence of gases, particle and other chemical compounds in the air that has negative impact to human living organisms and the environment. Air pollution can come from both the indoors and outdoor environment, but for the purpose of this talk, I will focus more on the outdoor environment. And as we all know, the outdoor air pollution can come from multiple sources, including mobile sources like trucks, buses, and cars. It can come from stationary sources, including power plants or industry, manufacturer. It can also come from area sources, such as a city as a collective, and then also large areas of agricultural activities. It can also come from natural sources, including wildfire, which I'll touch on in a little bit. The EPA regulates about 6 air pollutants that are very common, and they have been known to impact health here. And among these pollutants today, I'll be focusing more on ozone and particulate matter, and these are two very common air pollutants, and that are sort of like one of the most linked to health outcomes. Now, the good news is since the Clean Air Act and with many other effort, the air quality overall has been improving in the past number of decades here, where we're now in general on average we're doing pretty well with respect to the standard, right? And like I said, we will focus more on these two pollutants in a little bit, because here I have a sort of like a schematic of sort of the size of these fine particles, and the ones that we're particularly interested in is PM 2.5, which are particles that are less than 2.5 microns in diameter. And just sort of like just to kind of set the context here, this is the size of a hair strand, and PM 2.5 it's sort of like the size is about 1/20th of a hair strand. And so the point is it's small, so it can get into our system pretty easily and has health impact. So like I said in a little bit, a slide ago, is that our air quality has been improving. However, there are sort of areas in the United States that are consistently not being able to meet those sort of criteria or air pollutant standards. And so some of the areas I highlighted here, and so this is for PM 2.5. And so here we have a region in the sort of the Central Valley of California that's sort of kind of consistently are not meeting the standard. And part of that is because of the topography of the region, and then the other part is because of the different sources of pollution that are in the area, one of which is wildfire. If you've heard about probably a lot of time within these last number of years here. And then this is a map for ozone, and again we see areas in the United States that are kind of consistently not being able to contain, to keep these air pollutants under the recommended sort of guidelines by the EPA. And actually, I am from this region, and so you'll see some of the work later that are based in this region. And then the other piece to this is that more Americans, and this is sort of across the globe as well, but I wanted to kind of focus in America, in the US for this talk, just because of the time, right? And so, but more American are exposed to spikes in air pollution over time, and a lot of this has to do with, like I said, wildfire. And so, as you can sort of see here in this red bar here, I will take this as an example. In 2017 to 2019, we had about 54.4 million people in the U.S. living in counties with unhealthy air pollution level. But in 2018 to 2020, this number increased to 63.2 million. And then here on the side of the graph, you'll see the number of days with unhealthy or like sort of like hazardous air pollution. So this is for sort of unhealthy purple days, so kind of the days with air quality considered as unhealthy, and so that has been increasing. And then for the maroon sort of air quality here, which is very, very unhealthy, basically hazardous for human health, and these sort of polluted day have been increasing within the past sort of 5 years or so due to wildfire. And I'm sure many of us have heard a thing or two about the impact of smoking on adverse birth outcomes and on health in general. And it turns out that the impact of air pollution on health is pretty similar to smoking, except for the fact that we don't have as much choice when it comes to air pollution, because it's everywhere and everybody has to breathe. And not to say that sometimes we don't have choice with secondary smoking either, or tertiary smoking exposure either, but for air pollution it's a bit wider in terms of bigger in terms of a problem. And we know that air pollution impact on health ranges from short-term effects such as headaches or respiratory irritation, but then it's also related to long-term impact, including effects to the central nervous system. the respiratory and the cardiovascular system. And we know that for these outcomes, there are subgroups within the populations who are potentially more vulnerable, and these includes people with underlying health complications already, people who work or exercise outdoor because they were more exposed to air pollution, the elderly, children, and of course, pregnant people as well. Now, so these, you note here, there's no sort of indication of reproductive health outcomes here, but like I said, this is sort of emerging within the past couple of decades, and so the messaging is not as clear compared to health outcomes related to some of the other sort of like, body organs or body system, you may say it that way. And so, so this is sort of where my work comes in, and I kind of use this framework to kind of situate my work. And so, and this is basically kind of like it's based on the developmental origin of health and disease framework. And pregnancy is sort of, so it's right here, so like timeline, right, between preconception, pregnancy, and then postpartum health. And so pregnancy is sort of this very sensitive period during which, the health impact can be affected by the interaction between air pollution and other environmental exposure, and of course, existing vulnerability. And all of these have long-term impact on both the mother later in life and also, of course, the baby when the baby is growing up. And then I want to kind of mention this part as well, preconception health. Like Dr. Rupa was mentioning earlier, the air pollution and climate change effect, like extreme temperature and air pollution, there's a lot of work that link them to, cardiovascular disease, mental health, respiratory diseases that actually might be contributing to pregnancy health as well. So that's a piece that we may want to keep in mind, and we need more work on. Although for this talk, I will focus a bit more on sort of like health impact from here onward. Okay, so these are some of the work that I've been working on for the past maybe 10 years or so. And so we saw that air pollution has impact on the mother, the offspring, and also the father as well. And so some of the impact in the mothers include decreased fecundability, so decreased time to become pregnant, right? And then cardiovascular events during pregnancy, gestational complications, including diabetes and hypertension. For the father, we saw impact on semen quality, which has implication on, of course, reproductive health in general. For the offspring, we saw a range of impact, including pregnancy loss, stillbirth, preterm premature rupture of membranes, which is a big driver of preterm birth around the world. And then we also saw impact with preterm birth, and then low birth weight and growth restriction, birth defect, and then neurodevelopmental outcomes later in the babies when the baby grows up. But for the sake of today's talk, I will focus on just a few of these, as you'll see in a little bit. Now, one of the questions is, so why does air pollution and how does air pollution impact reproductive health? And so I kind of want to go over the mechanism a little bit here. So so air pollution can impact the mother and the father, like I was sharing a little bit earlier. And so some of the mechanisms that have been found in both animal and human studies that linked air pollution to reproductive health include alter cardiovascular function in the mother, endocrine disruption, immune and metabolic function, inflammation, and oxidative stress. These are big ones that Dr. Rupa was talking about earlier that was linking heat to pregnancy outcomes as well. And it turns out there's sort of like a common mechanisms there. And all these sort of like physiologic changes during pregnancy would can lead to these different placental factors, including alter implantation, placental development, nutrient transfer, oxidation oxygen transfer to the baby and also hormonal activity of the placenta. And all of these have impact on the baby, including organ toxicity, some epigenetic changes that may, turn on or off certain genes that may have impact on fetal growth outcomes, as an example, and then also hormonal activity in the fetus. And then, like I said, paternal factor, like semen quality, has been also linked to air pollution, which of course can contribute to, some of these sort of outcome later for pregnancy. And so, like I mentioned a bit earlier, a lot of the talks are going to be focused on sort of the effect from pregnancy onward, but I do want to bring up a couple of important reproductive health outcomes that we need to understand more, and we shouldn't forget. And that is fertility. So in order to get, a successful pregnancy, we need to, of course, fertility, to maximize fertility function as well. And so there is, in just within, I think it was last year, there's a pretty comprehensive systematic review on the impact of air pollution on fertility that came out. And basically what this group right here, Kumar and Singh, they found that air pollution, very similar to some of the other very toxic chemical like dioxin, similar to heat, like Rupa was talking about earlier, air pollution has a lot of impact on sperm quality, and these include things like decreased sperm concentration, also decrease sperm motility, and then increase in sort of the rate of abnormal sperm morphology. So things like, having a not optimized, suboptimal head size and things like that. And then also increased sperm DNA fragmentation. And all of these sort of like changes in the sperm have been found to be associated with decreased fertility in men. And then for a female, there are also studies, especially studies that looked at population that seek fertility care. And as you can imagine, studying fertility outcomes is pretty difficult. And so they've done a number of studies looking at, like I said, population who were seeking fertility care, and they saw that air pollution, so higher air pollution exposure, is associated with lower ovarian reserve, reduced time to pregnancy, and then also lower pregnancy rates among those who are seeking fertility care. And so again, for the rest of the talk, I'm not going to focus on these outcomes anymore, but I do want to, us to kind of keep in mind that these are also there. And so what happens then if, somebody becomes pregnant, right? So going forward. So in 2019, I believe, there was a group of researchers from Belgium who looked at this big sort of cohort study, and they were able to do some histological, studies, and they found that black carbon, which is the sort of like the particle, the soot in the particle air pollution that you see, and black carbon is very small, part of PM 2.5 that I was mentioned about earlier. So they found that black carbon was actually able to cross the placenta and get deposited on the fetal side of the membrane. And this is sort of one of the first studies that shows that. And so it turns out that, of course, I think we know this from previous research with things like dioxin, right? And we know that the placenta is really not a barrier. We call it the placental barrier, but it's really not. And so many of the environmental exposure can actually cross it. And so this is one of the first study out there that was able to show that fine particle from the air can actually go into, get to the other side. And they actually plot the concentration, the concentration of black carbon by gestational weeks of spontaneous preterm birth, and we kind of see that there is sort of like a correlation there where babies that were sort of like earlier, that were born earlier, had higher concentration of black carbon in the placenta. And then this same similar group of researchers in a year later, actually no, 2 years later, 3 years later, in 2022, so just last year, they combined this Environach study that I mentioned a little earlier from Belgium, and then they combined this with another Scottish advanced fetal research, or the SAFER cohort, and this is in the UK. So most of these data are from the UK, from Europe in general, and they saw that. So this is, you can sort of see here, it's also, sorry, the label got cut off there, but this is black carbon, count as well. And then this is residential black carbon exposure. So kind of they estimated the amount of residential exposure that the pregnant women had during pregnancy. And then they also looked at black carbon in maternal blood as well as in the cord blood of the baby. And they saw a sort of a pretty strong association there. And of course, there is sort of like a parallel between maternal blood and cord blood as well. And here is another graph that shows black carbon and residential exposure in term placenta. So the last slide we see is preterm placenta, and this is term placenta, and we can also see a positive correlation. The same study also shows that the black carbon gets deposited in multiple fetal tissues, including fetal liver, fetal lungs, brain, and of course, placenta, as we saw a little bit earlier. And I guess the point is these pollutants can actually cross the placenta and have adverse impact on the growing fetus. And so, you saw the slide a little bit ago, and for today's talk, I'll focus a little bit more on some of these outcomes that our group has been working on, and then I'll inject some of the work in terms of how what's out there in the literature. So for pregnancy loss, we had this study that was published in 2018, and we're interested in the does air pollution have any impact on pregnancy loss given the known biologic mechanisms, the potential biologic mechanisms between air pollution and reproductive health. And so what we did was we followed about 500 couples who were attempting to become pregnant in 2 states, Texas and Michigan. And among these 501 couple, 344 became pregnant. And we were able to geocode 343. One of them, the address couldn't be geocoded. And among these, we had 97 losses, about a rate of 28%. And so we estimated air pollution using a validated air pollution model, and we linked these estimates to the address of the pregnant person when they were they were pregnant. And then the outcome that we're interested in was time to pregnancy. So how long, right? So like not time to pregnancy loss. And it's not just loss, but also the rate of loss, like how fast does it happen? And so we estimated the time to pregnancy loss using daily ovulation test and of course pregnancy tests as well, pregnancy tests as well as clinical tests to confirm pregnancy. And so from that study, here you can sort of see the risk plotted on the y-axis and then the different pollutant plotted on the x-axis here. And we saw that ozone exposure, and so an interquartile increase in ozone exposure was associated with about a 12% increased risk of having a pregnancy loss. And then here, PM2.5, so the fine particles, so each interquartile was associated with about 13% increased risk of pregnancy loss. And then we're also looking at the PM2.5 constituents. So in other words, the different components within the fine particles, because we are, right, like the fine particles is a combination of various different particles and chemicals within it. So we're interested in looking at a few common known constituents in PM2.5, and we saw that sulfate compound was associated with about a 58% increase in the risk of pregnancy loss, while the other pollutants, we didn't see too much going on there. But And then we're also interested in the exposure during the sort of the last 2 weeks before the event happened, just to kind of get to the potential acute short-term impact of air pollution on risk of pregnancy loss. And so we didn't really see too much with the criteria air pollutants in general, but we saw some blip here with elemental carbon. So this is really essentially the same as the black carbon particle that I was mentioning about earlier. It's called elemental carbon here. The names are the names are different because of the way that they measure these, but they're essentially getting to the same thing. But we saw a pretty strong association between elemental carbon and risk of pregnancy loss, although of course it was not a statistical significant findings, but keep in mind that we had a pretty low sample of low number of people with pregnancy loss in the study. And then in another study, this is taking data from 12 clinical centers across the United States, we saw that ozone exposure during various windows, including the 7 days before the event, also the first trimester and across the whole gestational period. And so we saw that ozone exposures were also associated with increased risk of, this one is stillbirth. So we're talking about pregnancy loss that are a little bit later. And so this one, we're defining stillbirth as those that are the losses that are beyond 20 weeks of gestation. The prior study that I was talking about, these are a lot earlier loss, like within the first trimester. And so I think we don't have to belabor on the estimates here, right? The specific numbers, but overall, right? Positive association between ozone exposure and risk of stillbirth in this study here. Now, so those are just a couple of examples from some of our work, but what is the state of the literature? Now, this slide is very busy. I don't expect us to read all of that, but I'm going to summarize it for us. So so to date, we have about 7 systematic reviews on the association between air pollution and pregnancy loss in general. So this would include both miscarriage and stillbirth, which happens a little bit earlier. And while the earlier reviews didn't find any sort of like this consistent association between air pollution and pregnancy loss, mainly because there was not a lot of studies around, right? But the later ones that were published more recently found that there is positive association between pretty much all criteria air pollutants and pregnancy loss, including miscarriage as well as stillbirth. And so now, so what about fetus that actually survive, right? We're talking about those that are lost, but what about those that survive? So we have you've seen a slide, the slide where I list a bunch of outcomes a little bit earlier. It turns out that there's a lot of impact on these fetuses as well. Those impact include low birth weight and preterm birth. And I'm going to share with you some of the findings that we've had pretty recently in 2021, at the very end of 2021, at the turn of 2022. On the impact of air pollution and preterm birth in the San Joaquin Valley of California. If you recall, I presented one of those, a map earlier that kind of shows where the non-attainment areas for air pollution are. And the San Joaquin Valley is one of those areas where we consistently have very, very high air pollution, sort of like compared to pretty much all regions in the United States here. And so, so we're curious about, so what about, so how air pollution impact birth preterm birth in that area. So what we did was we selected 8 counties in the valley, and then we used a case crossover design to see whether air pollution exposure within the 7 days of the event increases the risk of a preterm birth. And this study design, basically what it does is that it compares air pollution during the 7 days before the preterm birth, and it compares that exposure to some other times during which the event did not happen. And this is sort of comparing within the same person. So we don't have to worry about confoundings by things like social economic status or, maybe even, underlying comorbidity. The samples include about 200,000 singleton birth, and we took birth from 20 to 39 weeks of gestation. Notice here that I included some of the birth that are kind of beyond 37 weeks of gestation too, because these are considered early term, and these are also associated with certain risks that we know of. So that's sort of the study region right there within California. And in this study, we obtained PM2.5 and ozone concentration from the San Joaquin Valley Air Control District, and they estimated these pollutants using a pretty validated model, and it has pretty high performance against historical data when they validated. And so we validated the maternal zip codes at delivery with the exposure estimated by the Air District, and of course the window of exposure that we're interested in is the exposure during the 7 days before the event. And so we saw that pretty much across the board. So this is sort of the risk level here, and this is the different lags. And so lags basically are referring to, so like lag 0 as an example is basically exposure during the day of the delivery. Lag 1 is exposure during the day before, lag 2 is exposure during 2 days before, and so on. And so on this first panel, there are the result for very preterm birth of 20 to 33 weeks of gestation. And we saw that there is a pretty kind of consistent increase in the risk of preterm birth here for pretty much all lags within the 7 days, within the day of delivery and the 7 days before. And then this is also sort of a similar pattern here, but this is for moderate preterm birth from 34 to 36 weeks of gestation. This is for early term birth from 37 to 38 weeks of gestation. And this is really important because a lot of time when we talk about preterm birth, we usually define it as before 37 weeks of gestation, right? But these early term births are also associated with other risk as well, but we also see that air pollution may contribute to some of these risks. And then this is, sorry, I did not mention, so this is for ozone, and this is for ozone during the warm season, and we did not see any impact of ozone on preterm birth during the cold season. And one of the reasons I think is just because, as we know, ozone it's more common in the warm season because ozone is sort of they call it a secondary pollutant, and it is a result of reaction between things like nitric oxides and other organic compounds in the air and light, UV light. Right, and so during the warm season, you have these a lot more precursor, and you have a lot more sunlight to promote the reaction. So it produces a lot more ozone in the summer, and so that's sort of again the impact of ozone on preterm birth in the warm season. And then so this is the same sort of graph here, but for PM2.5 in the cold season. And so in the we didn't see impact of PM2.5 on preterm birth in the warm season. We only saw it in the cold season. And it sort of also makes sense because during the winter, during colder season, there's temperature inversion. So it traps the PM2.5 closer to the ground. And so we have a lot more PM2.5 in the cold season. And sort of here we see the impact right here. Excess risk right here for very preterm birth. For moderate preterm birth, we didn't see too much. And then for early term birth, we kind of saw some weak associations there. I mentioned about wildfire and the San Joaquin Valley and California overall, and many other sort of Western states are exposed to a lot of wildfire. And so this is a study that came out also last year by a group from Stanford, and they, instead of looking at PM2.5 sort of like in general, they looked at smoke days. And so these are kind of, specific to air pollution, and they estimated smoke days by satellite imaging. And so they use about, if I remember correctly, about 2 million births from California, and they saw that this is percent change in preterm birth risk per smoke day. And these are the different windows of exposure. And so we see a positive association between smoke day exposure and preterm birth in California for, if we're talking about the entire pregnancy, the second trimester and the third trimester as well. And they didn't observe any interesting sort of finding for the first trimester. Now, so smoke days is positively associated with preterm birth. And then they also did a further analysis and they saw that this is mostly driven by the more PM 2.5 intense days. So they stratify the analysis by low PM 2.5 intensity, medium PM 2.5 intensity, and high. And so you can sort of see the risk here were mostly driven by the days that had more PM 2.5 intensity compared to the days that had a little less PM 2.5 intensity. So again, some evidence there linking kind of wildfire-specific pollution to pregnancy outcomes, specifically preterm birth here. And so what is the state of the literature looks like, right? I know, Rupa, you showed this a little bit earlier, but I believe in 2020, the Rupa and her group published a very important and sort of made a lot of changes within policy and perhaps in clinical practice as well. So a very important study that sort of summarized the literature in terms of the impact of air pollution and heat on pregnancy outcomes. So you saw one of the parts a little bit. So down here, I blocked it because I kind of I know Rupa was going to show it. But so this is the part where they looked at the association between air pollution and a few common, but of course serious adverse pregnancy outcomes. And it turns out that let me show here. There were, at the time of the review, 24 studies that looked at the association between preterm birth and air pollution, and 19 of these studies reported positive association between air pollution and preterm birth. And you can sort of see here too, for low birth weight, 25 of the 29 study, and for stillbirth, 4 out of the 5 studies. And then very importantly, the studies also shows that there is disparities in terms of the impact of air pollution on pregnancy outcomes. And a big proportion of the studies that are in the literature shows disparities where populations who are communities of colors, communities of people might be of lower socioeconomic status, maybe more impacted by air pollution, and I'll talk about that a little more in a little bit. You've seen this before too, and so I kind of want to remind us that although I talked about just a few of these outcomes with the limited time we have together, but keep in mind that there's a range of outcomes both for the mother, the offspring, and the father that are impacted by air pollution. And so what's the implication of all of this? We know that in the United States, about almost 5 out of 10, so 50% of our population is living in places with unhealthy levels of air pollution. And I think if we use the WHO standard, which is a little bit more it's a little bit more strict, right? Then I think that there's close to 90% of the world population is living in areas with high air pollution or unhealthy level of air pollution. And one of the things that we've heard about today kind of consistently is that people of color are about 4 times more likely than their white counterpart to live in a county with basically air pollution level that fails the federal recommendation. And so that's with respect to ozone and short and long-term particle exposures. Now, we saw a little bit earlier that while our air quality has been improving in general, and so you can sort of see here in the different lines representing the different threshold. So the different kind of, so this is threshold of, this is for PM 2.5. So threshold of less than 8 microgram per micrometer. This is 10 and this is 12. So 12 is sort of the current US standard. The US recommend sort of PM 2.5 standard. 10 is the the current WHO standard, and 8 is basically a potential future standard if we want to make it a little, safer for people. And so this study was published in in Nature, that shows that while the proportion of our population who is exposed to sort of unhealthy air pollution based on the different standard, these are decreasing, but the disparities that we're seeing among different racial ethnic group in the United States is increasing, as you can see in the different bars here, and it is regardless of whatever threshold that we use to estimate these. And so again, that's a big public health problem, because yes, our air quality are getting, better, which is a good thing, but there are certain communities who may not get the benefit of these improvement over time. Here are some data from the San Joaquin Valley that I was talking about a little earlier. We saw that this is the concentration, or the average concentration of PM 2.5 exposure during pregnancy by week. This is ozone by week, and this is stratified by the income level of the neighborhood that the person lived in. So in blue, it's a little harder to see here, but quartile, so it's by quartile. And so you can sort of see clearly that the exposure is a lot higher for pregnant women, pregnant people who live in areas with lower income for PM 2.5, and same thing for ozone as well. And so this sort of notion of sort of like this triple jeopardy that we're seeing in our population. I'll explain these figures in a little bit. But so we know that people with disability, people of colors, low income and indigenous community are more exposed to air pollution in general. And so here is actually a picture that of a daycare center that I took on, actually I did not take this picture, but I couldn't find the picture I took, but anyway, so I pulled this off of Google Map. But so this is a daycare center in Stockton, California, and guess what this is? This is a bridge. It's a highway bridge that actually is the roof of a daycare center in Stockton, and you go straight into here. And this is a figure of again, I took it from Google Map, and so, but I blocked off the face of of our children here anyway. So this is the playground, and again, see this bridge right here? And so it's like I was like, oh dear, when I saw this. But anyway, this is one example of certain. So this is located in a pretty. I would say very underserved area of Stockton. And the point here is, so these communities, right, they are a lot of time forced to live in areas that have more pollution. But then the other part of the story is that a lot of time these sources follow them as well. Because in this daycare center, this area actually was originally an area with a lot of people of color, Black and Filipino, I believe. And so the highway was actually kind of purposely put in that area, basically. And so it's like the chicken and the egg, right? So certain communities are forced to live in certain area with high air pollution, but some of the sources kind of follow them, which it's crazy. And so, so these communities are more exposed, but then even at the same level of exposure, these groups are also more impacted by air pollution as well. And there are many reasons that they are, it is the way it is, many of which Dr. Rupa already mentioned earlier, but a lot of this can be driven by the compromised background health that they already have because of, many reasons like social and structural stressors, and they don't have access to care. There are structural racism that we talked about earlier. And the other thing is that these communities often are contributing the least to air pollution, and they also often lack the resources and the voice to be part of the mitigating efforts. And so that's something that we have to keep on fighting for, right? And so this is a sort of a systematic review that came out pretty recently in 2023, so earlier this year, that looks at the impact of air pollution and the racial disparities in pregnancy outcomes in the United States. And without belaboring on the details, the main findings is that across all the review articles that these authors review, they show more adverse pregnancy outcomes, including preterm birth, small for gestational age, low birth weight, and stillbirth, related to air pollution among Black Hispanics than their counterparts. So again, even at the same level of exposure, these populations are more impacted compared to their counterparts. And so I wanted to kind of talk a little bit about the challenges that are related to the research that are in air pollution and pregnancy outcomes. And I kind of grouped them by 3 different categories. One related to the exposure, how do you measure the air pollution? The other one is the outcomes, how do you measure the different pregnancy outcomes? And then the other. And so one of the challenges that we have in the field is the problem related to the exposure measurement, right? So a lot of the studies, we have to kind of depend on air monitors that are sparsely located across the nation, right? And so the way that these monitors are located is not necessarily the most the best for research purposes, right? And therefore, so a lot of the monitors are not located in certain communities that have more health impact. And so a lot of so what we have to kind of depend on is air monitors. And so that may impact the way that we measure air pollution. It may be subject to misclassification. And a lot of time we underestimate, right, the amount of air pollution that people are exposed to, and therefore that's going to underestimate the health effect as well. We also don't have typically we don't have data on daily activity patterns or residential history of the participants. And so we can't really accurately measure. And a lot of time, again, we're underestimating their exposure a lot. And so some of the opportunities, we could consider prospective studies to kind of better measure some of these. And then the other part is we now have these sort of more affordable monitors that can be implemented in research, although I understand that they are not sort of regulatory or research grade. But they could be they can be a good supplement to our ongoing efforts. There are, in reality, a lot of complex interaction between pollutants, right? And so things like heat and air pollution, there's, I'm pretty sure, a synergistic effect between the two, but we don't have a lot of studies that looked at the interaction yet, but I'm sure there are a lot more that are coming in very soon. And so that's some of the things that I'm working on with my team at the time. There's mixture effect. So when certain pollutants are together, right, they're how's the impact? And then there are potential roles for non-criteria air pollutants. I've talked about air pollutants in general, criteria air pollutants in general, but there's a lot more that that may have impact that we need to still study, right? And so there's opportunities to work on that. And then the other piece is identifying windows of susceptibility, right? So right now we know some sort of we have a good idea in terms of when the exposures are the most important, but of course we probably need to understand a little more about for intervention purposes, right? When is the most the time that makes the most sense to intervene? And then constituents of PM2.5 and ultrafine particles. These are really important because PM2.5, again, is a mixture of a lot of different things. And so it might be important to understand what within PM2.5 might be driving health. And then, so that's sort of opportunity to address that. And then the other piece is the outcome assessment. So issues related to how we can measure the outcome. And so outcomes like pregnancy losses that I mentioned earlier, these are very, very difficult to measure because they occur very early on, before even some pregnant people might know that they are pregnant. And so we may miss a very significant number of these outcomes, leading to potentially underestimation of the risk. And so the exact time of the event is usually not available either, especially for things like pregnancy loss. And so that might be a challenge. And then for these two challenges, maybe prospective studies might be in the future, might be more prospective studies, might be is recommended. And then in terms of the outcome, the differences in the definition of outcomes across study. There are a lot of inconsistency in terms of how we define certain outcomes across studies, although I think preterm birth is one of the more consistent. Pregnancy loss, it varies, and because a lot of the time we have to use secondary available data, and so there's like a lot of, we have to kind of we're limited to the nature of the data. And so moving forward, I think to help guide policy, it might be helpful to kind of come to a more standardized way of studying these outcomes. And then others, a lot of time, like I mentioned, we don't have a lot of, we depend on secondary data a lot. And so a lot of times we lack critical information in order to understand fully the impact of air pollution on pregnancy health. And then we have very, very complex relationships, so temporal dependence and collinearity between the pollutants, which makes it really difficult to tease out their impact and further understanding them. And then this is should be number 3, but this is a very critical piece, I think. We have very limited data on susceptible groups. They are oftentimes not part of the research enterprise, and they are, and a lot of time, certain populations are, like in secondary data, they're not defined very well in the data that we use. And then if we were to collect our own data, many studies don't include susceptible subgroups enough. And so we still need to further understand health impact among these groups. And so in terms of potential solution, there are a few things that that we could be thinking about as potential solution, right? Green space is one of the things that I saw that may be mitigating the negative impact of air pollution and heat as well on pregnancy outcomes, because these, trees, green space, they can capture the particles, they can reduce photochemical formation of secondary pollutants. They can also help with reducing the heat island effect in urban areas, also improving mental health as well. Dietary antioxidant is also another mechanism that may be able to mitigate the impact of air pollution on pregnancy outcomes. So I saw some studies that looked at, there is negative impact of air pollution on pregnancy outcomes, but then for the people who have more antioxidant intake, the impact is lower. So it may help that. And then air purifier, I saw that there are studies that suggest that air purifier may decrease some of the, of course, exposure, and then also decrease some of the outcomes related to birth weight, and then also actually improving child neurobehavioral outcomes for the child later in life. And then there are individual changes that we could start implementing to help at the individual level. So things like check the air quality, use masks when necessary, avoid outdoor environment when there is high pollution, traffic, etc. And so what's next, right? And I think that's air pollution and pregnancy outcomes and health in general is a pretty big topic. And so in order to address them, we need pretty tight collaboration between multiple level or multiple sector within the society, including researchers, healthcare provider, policymakers, and so on. And of course, individual partners as community and individual partners as well. And one of the things that's really interesting here, healthcare providers, is they did a pretty large survey a few years ago, like international survey. And they saw that while a lot of healthcare providers believe in climate change and the impact on health, the barriers is like number one, they don't feel like they have enough resources to be able to comfortably discuss with their patient about heat and air pollution impact. Number two is the time. They don't have enough time with their patient, right? And so some of the recommendation from these participants is, of course, like, they need more time and they need more resources to help educate, getting educated on how to communicate these risks with patients. And so, yeah, we need sort of, moving forward, multiple actors to mitigate this. And one thing here, you've seen part of this graph, this diagram before, but as our climate conditions worsen, I think that we're going to start seeing a lot more impact in the adult, especially if we're talking about people with the uterus, right? And so we're going to see a lot more chronic sort of like morbidity, which will then increase their risk of having adverse pregnancy outcomes, right? And then the baby who underwent adverse pregnancy, who had adverse pregnancy outcomes, they will themselves will have increased risk of having negative preconception themselves when they become parent. And so it kind of create this sort of repeating intergenerational vulnerability cycle as our climate conditions worsens. And so I think it's really not just within a lifetime, but we need to start thinking about the next generation as well, because we're seeing this repeating cycle of vulnerability that we need to address. And so kind of as a concluding remarks, air pollution is pretty ubiquitous. It's everywhere, but it's not evenly distributed. It has profound impact on human reproduction, and it may amplify across generation. And we also need to keep in mind that certain groups in the population are more impacted than others. And while we continue to further understand the impact of health impact of air pollution, I think it might be prudent to consider the precautionary principle. And I know it's not as easy as it sounds, right? Because there's a lot of factors that comes into taking action, but it's important to keep that in mind because we're talking about reproductive health outcomes, and that has lasting impact for generations to come. And so with that, I just wanted to thank you for your attention and for the opportunity to be here. Thank you.
Thank you, Dr. Ha. That was an incredible presentation.
Thank you.
I feel like I gained so much, and my mind is about to pop because I have so many questions. One of the things, we talk about how air pollution is ubiquitous, and for many people, like moving is not an option. You're where you are, yeah. And so a lot of the times it's what you do on an individual level that might, help to mitigate some of these impacts. So my question is, have you seen any studies where in that preconception period, like the mother and the father do some of those like antioxidants, like change their individual behaviors, looking at it for like a couple of weeks or months before conception to see if that might help with some of the reaching like full birth pregnancies, full pregnancies? Do you know if any research studies exist out there that are looking at that health before the mom gets pregnant?
Yeah. Thank you for the question. Yeah, very important question. Rubal, please feel free to jump in. I know you have expertise in this field as well. I know that there are a couple studies. So an example is a study that actually looked at not really pregnant people in general, but actually this is one of the ones that I was involved in. So we looked at air purifier. And so we have this like randomized crossover study where we randomize half the people. So these are adult, not pregnant people. So we randomize them to half of them to receiving the air purifier, getting the air purifier in the house. Half did not, with the sham purifier. So we still give them a purifier, but it's sham. There's no filter in there. But anyway, so then after a few weeks, I think a couple weeks, we saw that the group that received the purifier had significantly lower level of some of these biomarkers. The mechanisms that I was presenting earlier, right? The biomarkers suggesting potentially, health impact later. So air purifier was very effective in that sense. Again, not in pregnant people. And then I also think that there are a couple of studies that shows, so these are I think it was like secondary data analysis using existing data, but they saw that people who took antioxidant were having lower risk. So the association between air pollution and some of these birth outcomes are there, but the people who had higher antioxidant intake had lower risk compared to those who did not. So that was one thing that I saw. And then there was another study that looked at the impact of air purifier use during pregnancy. So not necessarily preconception, but during pregnancy. And they saw that was associated with increased birth weight among term baby. So that's reducing the risk of low birth weight and sort of in term baby. So that was one I saw. But I don't know, Rupa, if you are aware of anything on the top of your head right now. And then green space is one thing I mentioned. But yeah, I don't see a lot with pregnant women in general, or like adverse pregnancy in general. Maybe, yeah. But I don't know if that addresses some of your
some examples of what could be done. I do have one more question.
Yeah, of course.
For you. So we work with community partners, and we fund all different types of public health initiatives. But I'm wondering for some of our like communities of color that are most impacted by air pollution and that sort of thing, like what are some of where do you think the investments should be to help like mitigate the fact that, like, again, they can't move, they're in these places? Have you seen, communities coming together to, do a green space project, or like, what have you seen that as government agencies, we can say, like, we need to invest more in this to help with the low birth rates in this area for this community? We already know that there's data that shows exposures are going to be higher in this area. Like, what are some of those things that we should be thinking about, that we should put our investments in to help reduce those exposures to the communities that are most impacted?
Yeah, I think that's a great and important question as well. Thank you. One of the things I think is, one of the things that we first kind of need to work on is awareness too, right? Like education and awareness, right? Because a lot of us, when we hear about air pollution and health, we often focus more on sort of like respiratory, right? Like cardiovascular health. We rarely really talk about pregnancy health. And I think one of the things to invest on, of course, is awareness, right? Like kind of advocacy work. And then the other one, I think, I've seen communities who work on, but this is more of like heat advisory thing, but planting trees, right? And so like one of the mechanisms that green space helps with mitigating some of these impact is that it captures a lot of the air pollutants, and then it also helps with reducing heat and things like that. And so green space is also something that I think it could, and it's not just protecting pregnancy health, it's also, right, other health outcomes like mental health outcomes and things like that. So I think those are some of the areas that could be future efforts to address some of these concerns. What else? I'm trying to think. Yeah, so I don't know. I'm happy to chat more too. It's like it's a lot, right? Okay. Yeah.
Other questions?
Hi, yeah, I have a number of questions,
Awesome.
but I will try and keep it just to one. So earlier on, when you were looking at the wildfire exposure and you found, or the study found it increased in the second trimester, has that been found in air pollution as well?
Yeah, so it depends on the outcome. So like in air pollution, a lot of the association between air pollution and like say preterm, for example, a lot of that is actually the third trimester, right? Like recent exposure and the third trimester, some in the first trimester as well, and then some in the whole, like sort of like average whole pregnancy. And so that particular one was quite interesting that they saw. I think that study saw second and third trimester as well, right? So yeah.
And the first trimester, you think that could be that some of those pregnancies were lost, and
that's possible. That's
right?
one of the things is, right. That's one of the challenges in studying these like downstream perinatal health is because we're capturing those that made it, right? And those that didn't make it probably had even higher exposure, and we were not able to capture them, which may lead to estimation of some of the risks that we see. So yeah.
And something else that comes up when we're kind of approaching people about advocacy around wildfire smoke exposure. So like if you had to choose, put a pregnant person in like a city where it's chronic air pollution throughout the pregnancy, or experience, really crazy spike in PM 2.5 and possibly other things for 3 or 4 weeks. Do you have a sense in which is worse? I mean, or like, are we beginning to understand like how much of this is cumulative as opposed to like shocking for the body? Like for example, someone in a rural area who maybe isn't exposed very often to air pollution and then suddenly gets inundated with wildfire smoke.
Yeah, so that's an interesting point, because like I know Rupa was talking about this earlier, where like people who might be more acclimated, right? Like so people who are kind of all of a sudden who are exposed, I think that the impact for them, not that it's like less for anybody, but like the impact for these people is probably going to be a lot more just because they are not used to that. And so I don't know. I mean, with like, I forgot what the first part of your question is, but can you repeat that just to make sure
My interest is really how much of the problem is cumulative and how much is about the shock to the body.
Yeah, I think
so. Like in oxidation, like do you get like hardened? Does your body stop getting so inflamed if you live in air pollution all the time, or is it actually that's really the worst case scenario? Is you live 30 years in like chronic.
Yeah, that's a good question. I'm not sure like how much in terms of the proportion of the impact. I'm not sure how much, but certainly I think as sort of as the climate condition worsen, I think we're going to be exposed to both. But so like we have this like sort of like average, very high exposure that has these like produce these like underlying health impact, right? Preconception health impact, for example, cardiovascular disease, mental health, etc. And then like we're seeing more of these spikes, so it adds to the problem. So I think it'll become sort of like this sort of like synergistic impact going forward. Although I don't know if I can answer directly your question about sort of like, how much of this is more chronic, how much of this is more acute. But I think as both of them have very important contribution to health for sure. I don't know if
that's brilliant. Thank you.
Thank you.
One more tiny question.
Of course.
So do you know if anyone has studied SIDS and air pollution? So that's sudden infant death syndrome.
Yes.
And that's something that's come up with a wildfire research is pediatricians worrying like whether wildfire could also have an impact on that.
Yes, I've seen studies on infant mortality associated with air pollution, although many of these studies were not able to kind of like tease apart what are some of the reasons for these infant mortality. But certainly, yes, I definitely have seen those. Yeah, very important. This is such a big field. I wish we can cover more, but yeah, it's Thank you.
Great questions. I just have a quick question also. The timing complexity is really interesting throughout the trimesters, and it seems like there's a more clear picture with heat in terms of exposure, and even enough so that we can give pregnant people advice if people have the privilege and ability to be able to time and plan their pregnancies a little bit. Do we feel like the science, there's kind of that, it doesn't seem as clear in terms of, it seems bad in all the times. Is there do we have a clear enough picture in terms of the data, in terms of if there's a better time to get pregnant in terms of seasonality and wildfire exposure, I guess, to follow up with what Sky was asking?
Yeah, I for air pollution, I see a lot with like I said, like for preterm, third trimester, whole pregnancy. For stillbirth, though, it's the first trimester, because a lot of the stillbirth and pregnancy loss occur kind of earlier, right? So first trimester is, so it really depends on the outcome we're talking about. But I think, right, no level of air pollution is good. Like, it's like we don't have a safe level of air pollution, and especially when we see that chronic sort of like whole pregnancy exposure is bad overall. So I think we can like minimize it, as much as we can over the whole pregnancy period. But I don't think I think there's a lot more work in terms of like how to understand more about the specific, very refined window that we can intervene. But I think while we're trying to figure that out, I think it's still like, it's just, there's no such thing as a safe level. And so minimize as much as we can, I think. Yeah.
Systemic policy action. There's no such thing as safe air pollution.
Yes.
Thank you so much, Dr. Ha.
Thank you. Thank you for having me.